Today I'm going to talk to you a little bit about trauma, and this is an area that I've had a great deal of experience with over the years in my practice. A traumatic event is something that is stressful and unexpected. Typically leaves a person feeling confused, stunned, vulnerable, and wondering how to make sense of what happened, or how they're going to move forward. A traumatic event can involve a threat to the person's life or safety. However, it does not have to be this. It can be any experience that leaves an individual feeling overwhelmed or alone. Childhood trauma increases the risk for adult trauma. And following a traumatic event, an individual can have a number of different reactions, whether they are physical, emotional, or mental. These reactions are a normal reaction to an abnormal event. And the idea is that the person is really trying to make sense of what happened to them and why this happened. These symptoms can last days, weeks, or months. And grieving is a normal part of this process. Recovery takes time, and people move through this process at their own pace. If an individual is still feeling strong symptoms and disruption to their life after many months, this is a clear sign that they need to speak to a professional or seek professional assistance. Post-traumatic stress disorder is the most severe of the trauma responses and typically includes people who are having flashbacks, nightmares, avoiding situations that remind them of the trauma, and living life with this increased sense of arousal, like they always have their guard up or their back up or they're waiting for the next bad thing to happen. Cognitive behavioral therapy is one of the leading approaches to dealing with post-traumatic stress disorder. And what we do is we look at the areas that are being avoided and systematically and gradually confront those issues in order for an individual to regain their own sense of personal power and control over their lives.